Hi, I'm Dr. Jolie Silva, Clinical Director here at New York Behavioral Health. For our April newsletter, I wanted to honor National Autism Awareness Day, which is April 2nd, by talking a little bit about autism spectrum disorder and the diagnostic criteria for autism spectrum disorder, which has changed in the recent diagnostic manual. So I'm going to refer to autism spectrum disorder as ASD. So there are two main criteria in order to have an autism spectrum disorder diagnosis. And the first is a persistent deficit in social relationships, a persistent deficit in the way somebody interacts socially, which is manifested in three different ways, really. The first is social reciprocity, that natural back and forth that we do when we're having conversations or when we're interacting with somebody. People that might be diagnosed with ASD don't have that natural social reciprocity that others do. A second would be a deficit in nonverbal communication. So we communicate a lot through our facial expressions and our eye contact. And people who might qualify for a diagnosis of ASD don't necessarily have that awareness of nonverbal cues. And the third would be the understanding and the maintenance of social relationships. Oftentimes people diagnosed with ASD don't have a real understanding of the way relationships work and how to maintain them. Of course, there are levels of severity, which is why it's called a spectrum disorder, because there is a spectrum. Now, the second diagnostic criteria has to do with repetitive engagement in repetitive behaviors, whether it's motor behaviors or verbalizations or interests or activities, is kind of this repetitive pattern that you would see, which to meet diagnostic criteria, you have to have that present in at least two ways. So the first way that it could be present is having an inflexible adherence to routine or rituals. And if thrown off course or if thrown a curveball, let's say, somebody with ASD would have a very hard time, like to eat breakfast the same time every day, do everything the same way, have that inflexibility. There is also either a hyper or hypo reactivity to sensory input. So loud noises or touch or something they might be super sensitive to, or they might go in the other direction and might not be sensitive enough. So they might not necessarily feel pain the same way that somebody without the diagnosis might feel pain. Another part of the repetitive is a repetitive motor or repetitive verbalizations, kind of saying the same thing or doing the same things over and over. And lastly is a very restricted interest or focus on a particular activity or particular object. Just very super focused on one thing that might be out of the normal range. Like just a fascination with dinosaurs, but like a super focus. Now, in order to have an ASD diagnosis, it has to be present in early childhood. It can't be accounted for by an intellectual disability or a more global developmental delay. And of course, as always, to have any kind of mental health diagnosis, there has to be impairment in functioning. With ASD, there is a spectrum, so it can range from mild to moderate to severe. So in honor of Autism Awareness Day, please wear your light blue color, which is Autism Awareness color. And if you have any questions about autism spectrum disorder, please feel free to look at our website, newyorkbehavioralhealth.com. Feel free to call. You can always have a consultation if you wanted to have your child evaluated, if you have any questions for us. And again, it's newyorkbehavioralhealth.com. Thank you so much. Have a great month.